Hi, it's Sunday morning, and Andy and Alan are here with you on the Return to Healing podcast. And we talked last time about several things, but we ended by saying maybe we should talk about antibiotics because antibiotic use in this country is out of control. Um, and there are lots of even protocols. We don't usually support the protocols, but because they're written by groups with strong ties to drug and device companies and specialty societies. But the protocols here are not, and they are, there's a couple groups that talk about how dangerous the overuse of antibiotics is. And I just want to start by saying this because we may not even get to it that the development of antibiotics in the early 1900s is one of the two or three things that truly changed the trajectory of longevity and health in this country. You could point to our ability to use antibiotics, especially on kids, our ability to prevent women from dying in childbirth, and our understanding of sanitation as the three biggest things that led to longevity. And if you take everything else and add that to those three things, you either get no increase in longevity or a decrease in longevity. I mean, it's funny, all the cardiac stuff that's going on actually has led to a decrease in cardiac longevity. All the stuff we're doing for strokes is leading to more strokes. But these three things, including antibiotics, maybe especially antibiotics, has people would we talk about COVID where overall in this country 3 out of 1,000 people died. Alan and I happened to be working in areas where the death rate was far higher than that. But overall, that was the death rate. If you talk about, I'm a historian, and throughout history, including into the mid 1900s, early 1900s, a typhus epidemic could go through New York and kill 10% of the whole population. Smallpox was killing 30 million people a year until about 1920. That was immunization that got rid of that. Typhus was the antibiotics, but all these things were helped by antibiotics. So, yeah, I mean, the problem with overutilization should not make us realize the importance of antibiotics.
Right. So I agree with everything you said except one. I'll add there's one other public health measure that has been shown to improve people's health, and that's primary care. Those that have a
That's
primary
true.
care physician live longer, but everything else, all these procedures doesn't work. But Andy, you're so right. I have a cold now. People might hear it in my voice. I'm congested. This is a common visit to my office for like 3 days. I've had phlegm and runny nose and coughing up some little stuff, but no fever, no body aches. It's clearly a viral URI. And I have patients walk into the office with those symptoms every day. And when I tell them that they have a cold and drink some hot tea with honey and lemon and chicken soup, the response is, no, I'm here for an antibiotic. And now I know I'm in for a fight because what do you do? And this is the dilemma that most healthcare providers are in. You know, your patient is in front of you. They came in after 3 days of a viral illness. They'll probably get better in 3 more days, but they're there thinking that they're going to get an antibiotic because urgent care will give it to them. They don't care. Urgent care just wants happy patients. So when a patient comes in for urgent care, the doc says, "Oh, here, amoxicillin," and writes amoxicillin for a URI, and they're not penalized and punished like we are in primary care because it goes on my report card when I overwrite that. We'll talk about that later. But no one discusses the harms of what this causes. So for me not to write that antibiotic, for me to say, I'm sorry, but I don't want to hurt you. This is bad. This could cause you side effects and other things and add to antibiotic resistance. It takes 5 minutes, 7 minutes to explain to a patient why they don't want antibiotics when they came in for antibiotics. So it's a dilemma we face every day.
And to take your story, which is a incredibly common story, you mentioned that by the time they come to you, they're going to get better in 2 or 3 days. So if they get the antibiotic at that point, they'll think that's what made them better. And
Exactly.
and that and now they're programmed to think that. So what I happen with when I have this fight, which I do very often, and if I win, and I don't always win, I would say 90% of the time they call the office the next day and say things are getting worse, they need the antibiotic. And they just say it to my receptionist, and then I give them the antibiotic. And I know it's the game's over. I'm not going to win this thing. And it is. Look, you look at sinusitis and bronchitis, the two of the three most common reasons. The other one being urinary tract infection. None of which actually should get antibiotics 99% of the time. But if you look at sinusitis and bronchitis, that they are self-healing. The body takes care of them. Even if they're bacteria, the body tends to take care of them. There's little distinction in symptoms between bacterial and viral bronchitis and sinusitis. I did a video on this, and I'll attach that um, to when we have this available. But what we found is that, and this is also what's the group that gives guidance that makes sense? Caring, or what is it called? We're old, so I don't remember. I'll put that up too. There is a group that really speaks strongly against using antibiotics and all these things. But here are a couple of things I learned that it doesn't change outcome in a positive way, whether you give Augmentin, which is stronger than amoxicillin, or placebo, or Tylenol. All three did exactly the same way. Well, Tylenol gives you autism, I hear now, but just joking about that. But here's the real dilemma, Alan. And we've talked about it before. We have this gut bacteria that truly is important to the function of our body. And one of the biggest functions of gut bacteria is in our immune system. It helps our immune system fight things like viruses. When we give antibiotics, we kill the gut bacteria. So now these people are coming in with a virus. We give them a medicine to make the immune system against the virus worse by giving the antibiotic. We actually make the virus worse. So it's not like it's just neutral. You mentioned a few other things, societal anti-resistance to antibiotics, but also individual resistance to antibiotics. So if they actually have something real, now the antibiotics don't work. And you have side effects and potential allergic reactions from all these antibiotics. So it's a shit show if you
Yeah,
give them.
no. And we know there's so many bad things. It accelerates the antibiotic resistance. We know is probably one of the biggest ones. We know, as you said, it increases the risk of adverse effects. So, people are likely to get sicker if you give it. But again, people don't get it. But I got my antibiotic. But we haven't talked yet about the costs of it, the death rates associated with. I mean, people die from not having an antibiotic that works, and people die from the side effects of antibiotics, like, Clostridium difficile, which is a result of the overuse of antibiotics, which is a gastrointestinal infection, as Andy said, from screwing up the gut biome. And that's what these things do, that you end up with this prolific diarrhea and what's called a pseudomembranous colitis in the intestines that in frail elderly or even young people could kill them. Like there's a mortality rate associated with C. diff. And the other mortality rate is, and I see it and I'm sure you see it in your geriatric patients, but I see it in when we get palliative care consults all the time, is that, we're consulted on a patient that has what's called, multi-drug resistant organism, or, commonly known as a superbug or something like that. And there's literally no antibiotic that we know works. Like they've gone through the culture and sensitivity reports and nothing works. So therefore, this person's likely to die because we have nothing to give them.
Yeah,
And, and, and it's not talked about.
and that is truly the result of us giving too many antibiotics. And early in my career, one of my colleagues was being sued. Uh, Not his fault. But they sue us anyway. But he's being sued because somebody gave him a very mild antibiotic called Bactrim. And he developed a skin reaction that basically was the same as a third degree burn.
Steven
Um,
Johnson syndrome.
yes, and that's what he got. And he didn't die from it, became darn close. Again, the guy being sued didn't give the antibiotic, but that's how things work in the world. But that's a simple antibiotic. They're like, what's the harm? Urinary tract infections are the other big one, Alan. In my world of geriatrics, anyone starts thinking badly, they get an antibiotic. If I check the urine on all my geriatric patients, they could all have something in their urine dipstick that shows they have an infection. And they all have bacteria in their urine. That's protective bacteria, kind of like the gut microbiome. It keeps bad infections away. And
Abs-
now we've killed it. We've just killed that with the antibiotic, made things worse. And when they go to the hospital, Alan, they're not getting amoxicillin. They're getting IV antibiotics for a
Triple.
phantom urinary tract infection. That's what they're getting. And they come back sick a lot of times from these massive antibiotics that the
Yeah.
hospital has to give, or else they won't get paid. That's at least in my state, that's what I've heard.
No, it's like that in New York too.
Yeah,
Why did
so
you admit them? What were you
exactly.
doing for them? But
Exactly.
that's why, like, I tell people all the time that come in for, a routine exam and they say, "You're not going to check my urine?" And I'm like, I don't think so. Do you have any symptoms?" And they're like, "No." And I said, "Well, we're not going to diagnose anything in your urine if you're not having any symptoms, and we might find something that you think needs to be treated that doesn't. So no, we don't do it." And the only time I check a urine on someone is to check for protein in a diabetic or a hypertensive, and there I'm careful to only check for the protein because otherwise you're going to find something if you do a regular urine. And you pick up these infections that are not there. So the only time I do it, if someone comes in with, a symptoms of an acute UTI, they got pain, burning, frequency of urination, they're in significant discomfort, that's when you do it. And that's the few times they need the treatment. But we shouldn't be doing routine urine in anybody.
Yeah, and it is like an epidemic of overdiagnosed urinary tract infections in people who don't have urinary symptoms. Again, in my world, the biggest reason is change in mental status. They're confused. They do a urine, find a couple cells of something, and treat with massive IV antibiotics um, for something that was about to go away on its own anyway, or has a completely different cause that we should be looking for. When we go down that road, we've now closed up the other roads of what's causing this, and it might be something else, including over medication, which is usually the case. But again, think about all these people getting antibiotics in. I mean, it's kids get them constantly for viruses. And I tell my patients, and I also give talks about this, yeah, you could have a virus like, let's say, the flu. And what do most people die of from flu? They die of a bacterial superinfection. So I say the key is not to treat this virus, but if symptoms change, I said, all of a sudden they're getting a little better, and all of a sudden they get worse. They can't breathe. They have a deeper, thicker cough, worse mucus. Their fever shoots up again. Yeah, then we need an antibiotic when that happens. So again, the judicious use of antibiotics. We don't ever want to say the non-use, but the judicious use. The current use of antibiotics is making infectious death higher. And for the reasons you stated, Alan, the resistance that we are creating is scary because we're going to find some bugs that we don't have any tools to treat, and they could spread through the population, not just affect the people who are taking all these antibiotics. So that plus the side effects of the antibiotics, plus the fact we're killing our gut microbiome, this is making more people sick. Great for the medical industrial complex, terrible for humanity that we're supposed to be helping.
Yeah. The one we didn't talk about yet, the one that I laugh the most at, like I sometimes have to laugh at the patients when they ask me for this, is someone comes in with like typical symptoms of gastroenteritis, 2 days of not feeling well with like some nausea, no vomiting, and prolific diarrhea, uh, no acute significant abdominal pain on exam. They're well hydrated, and they're now asking for an antibiotic. And what I laugh at is, we know every antibiotic can cause diarrhea, but the most common ones are the ones that we prescribe the most. Things like Augmentin, for example, which has a significantly high risk of diarrhea in a well person, let alone giving it to someone who already has diarrhea. And I have to laugh. I'm like, I have to draw the line here. Like, it's like, do you really want me to hurt you? Like, I'm gonna hurt you if I give you this. Like, you're instead of your diarrhea lasting 2 more days, it's gonna last 2 more weeks, and maybe you'll get a super infection of Clostridium difficile on top of it.
Yeah, and they all think, well, it worked last time, and it's the same thing you deal with. It's this coincidence, this correlation. I got the medicine right when I was about to get better anyway. Like we talked about with back pain, that's most back surgeries that help right at the time people were about to get better. And that's been the danger, the fight that we have, and it is a fight because we're fighting not just for the patient in front of us, but we're fighting for everybody because we're gonna really wipe out. Humanity is, I always think, we're from a perch where we see bad things. Humanity is always vulnerable to another super infection, whether viral or bacteria, and we're just making it more likely by our proliferative use of these antibiotics, which are one of the biggest sellers. That's one of the bigger profits for the medical industrial product, because it leads to hospitalization, often from the side effects of the antibiotics, which are very profitable. Again, we're one of the few industries that benefit when we screw you up,
Yeah.
because you get more medical care. So not a
It,
bad
it's
thing.
it's true. Everything is just getting worse. We haven't discussed, and the last article I remember reading, upwards of like 50% of antibiotic prescriptions are totally unnecessary. Your watchful waiting antibiotic is I do it often. And again, I'll cut down on some prescribing by not doing it, but many times you get the call the next morning,
Yeah,
and
the
like you
next
said,
morning
you,
call,
you,
yeah.
you just give in. Otherwise, you're going to have to now get on the phone and get 15 minutes later in your day because of fighting for someone for something that they don't need.
Yeah,
So,
they'll beat you. They know how to beat you down. They can get it from you. What one last thing I want to bring up has nothing to do with this. Maybe not the last, but as much as we overprescribe antibiotics in this country, and we are so far and above higher than any other country around, because people feel like they need them. Despite that, Alan, and this is something we could talk about in a future talk, 95% of antibiotics prescribed to this country are given to animals that we eat. 95%. And so even when we think we're being careful, and not taking antibiotics, we're getting antibiotics through these animals. And, unless you get, let's say, a chicken or beef that says no hormones, no antibiotics, you're getting antibiotics every time you eat the freaking animals, eggs
right.
too. And
And
and so
that's
we're
why,
resistance is being built up that way also. It gets you whether we prevent you from taking them or not.
right, and unless you're on a plant-based diet, you are exposed to antibiotic resistance because of these. And you're
Yeah.
getting such low numbers and low levels of antibiotic that it just breeds more and more resistance to this. It
Yeah,
is it's an epidemic. It really is a public health emergency in this country because it's not gonna get better. It's getting worse. I think personally, I think urgent care centers feed this.
oh
So,
God, yeah.
I touched on it a little bit, but my charts get reviewed by the insurance companies every time I prescribe an antibiotic. Some computer is, in the background reading. So Roth prescribed Augmentin for a diagnosis of bronchitis, and I'm dinged if I put those two things together because, as Andy said, bronchitis is a viral infection, and why should you give it? Well, sometimes I have people with a little fever, they have thick sputum, maybe a little shortness of breath, but it goes on my report card with the insurance companies. The urgent care doctors, the ER doctors, the hospital doctors, they don't get those report cards from the insurance company. They don't care what they do. They like urgent care centers because the cost is cheaper than the emergency room for the insurance company. So they're happy about that. So they could do whatever they want. And our patients are used to getting them because patients go to urgent care, they get antibiotics, period.
So and when we get dinged, I don't think the insurance companies really care, but I think the insurance companies are pretending to care because they have to pretend to care about some things, and this is low-lying fruit, and it's easier for them to go against primary care, than to go, let's say, against an infectious disease doctor or cardiologist who, frankly, have better lobbies and are not going to put up with it. We have no resistance, Alan. We are We are vulnerable to everything. So when they want to create their report cards, you look at them. They're all primary care focused report
Yeah,
cards. They're just coming after us for stuff that everybody else is doing, but they don't get dinged for it. And we're the ones trying to be stewards here. And yeah, sometimes I get someone with terrible emphysema, um, and they, God, I got to give them an antibiotic when they come in with a respiratory infection because it'll flip fast to pneumonia. And when I see any sign of it, I'm going to give it. But the key is not whether I give it or not, Alan. It's what the diagnosis I put down, right?
exactly.
So it's playing a game rather than really, dealing with my thought process of why I'm doing this or not doing this. It's the game where we've had to get good at to defy these crazy recommendations that are so generic that they do not take the individual patient in mind. And yeah, so a lot of primary care doctors, unlike us, Alan, are not fighters. They're going to do whatever, whatever's easiest. So it's the battle between the insurance company and the patient. They're going to pick the patient and they're going to play the game, and that's how they'll do it every time. So most of my patients who go to urgent care get antibiotics, but I have a lot of people I know who go to other doctors who get antibiotics just as often, and not amoxicillin, but Z-Pak, Levaquin, big dog stuff that causes resistance.
So I just got, I'll share quickly because you brought up Levaquin. So I get an email message in my in basket from one of my patients on Friday morning. Can I give her five more, or I think it was 4 more days of Levaquin because she has bronchitis and she only had 3 days of Levaquin left from the last time. And she wants me to prescribe that. So it got me aggravated that I was actually on a Zoom meeting at the time, so I had some time. So I sent this very long text and talked about the black boxed warning of Levaquin, of, tendon rupture and mental status changes, especially in elderly, and all the crap that that drug could do, and that she expects me to prescribe a dangerous drug without even listening to her lungs. And I gave her a list of questions like, who diagnosed the bronchitis? Who told you you had it? Where did you get the three Levaquin from? It's
It is it's quite interesting how people get antibiotics, but I think there's like a family storehouse often that they share with each
well,
other.
in Queens, the county I work in, you could get it at the bodega.
Oh wow. So yeah, so there are many places to get it. And yeah, this is something that the medical community, I give them credit, as a community is aware that this is a problem. They're trying to do things. Unfortunately, like you say, Alan, the problem is not usually sitting in the primary care office. We are dinged for things, but I don't know the numbers, but I would say the vast majority of antibiotics prescribed are not prescribed in our office.
It's the last I read, which was not that long ago. It's estimated to be about 50%, half of what
Yeah,
we
half.
do.
So that makes sense, and it's just going up with the proliferation of urgent care. It's going to be more and
And
more.
the other issue we didn't discuss is, when was the last time you saw a new significant antibiotic released?
Oh, right, nothing. It's been forever. They're all copycat drugs. That's all we're getting, and they make it seem like they're new, but that's not where the big bucks are for the drug companies. So it's interesting. The drug companies aren't making a lot of money on antibiotics, so they're not playing that game. It's the other aspects of the medical industrial complex that are making money from this, mostly hospitals. They see all the results of poor management of antibiotics. And by the way, the hospitals, the resistance rates are really high, right? If you happen to acquire an infection in the hospital, there's a high death rate. What do they say?
Absolutely.
About 150,000 people a year die from getting an infection in the hospital because there's so many antibiotics being given in the hospital that all they breed are these resistant bugs that
Right.
are lethal.
So there are some estimates, I know this is arguable, that the third leading cause of death in our country is the hospital.
Yes.
And out of that, hospital-acquired infections are near the top. So this is a
Yep.
huge problem. And, people need to stop asking for antibiotics is my mode. Like, why would I not give one to a patient if it was appropriate? Like, people got to
Exactly.
trust their providers. I think the take-home message is, to folks that are listening is if your doctor says you don't need antibiotics, don't fight them for it because they're trying to help you, not hurt you.
And really, how many times in this country do doctors tell you not to take something? That this is one of the few times they're doing it. Trust them because they're usually telling you to take stuff. Doctor tells you not to take something. That means pretty much they're pretty confident that you don't need it. And so yeah, that's the lesson. Fewer antibiotics you take, the stronger your immune system's going to be.
Absolutely.
And you just got to stay away from them. They do, when you hurt the gut microbiome, Alan, you're hurting your whole body. You're inflaming your whole body. It's just a mess.
That's
Uh,
why if you're a parent of a little toddler, let them go out there and play in the dirt and play in the sand
exactly.
because that's where they pick up, they build their immune system there. Keeping them out of those things have weaker immune systems. It's been proven.
It's interesting. I'm reading this book called Anti-Fragile, written by a day trader on Wall Street, but he talks a lot about the medical system and how we so try to micromanage disease that we're ruining the body's ability to get stronger. And
Hmm.
that's one of the examples he uses by preventing anyone from getting sick ever, using all that hand sanitizer constantly, keeping people away from sick people. We're making disease worse. We're because by
Absolutely.
hurting the immune system. It is kind of we have to give ourselves a little stress to make ourselves stronger. And these are little hits that are not worthy of antibiotics, which again, we have a sense of when to give them. We're not nihilists by any means. Okay, we got a lot. Also, we talked before we got on the air about what we can talk about next week, but a lot of good things that
Yeah, I
will.
came up with a couple of ideas. So you talked about back pain. We haven't done one on back pain, Andy,
We haven't
and
done one on back pain.
I
Okay.
don't think so. And the overuse of MRI and the overtreatment with epidurals and trigger points and electrical stimulators and the ultimate, disaster of back surgery. So maybe on one of the next podcasts.
Okay, that sounds good.
All
Okay,
right. Have a
Alan.
good day,
Have
everyone.
a great day. Take care.